Madam Chair, members of the committee, Senate Bill 1308 is similar to last year's bill, but includes both generic and patent brand drugs. The only thing it does is allow the Attorney General's office to issue significant technical records to determine, to look into whether or not there's price gouging. We know there's a lot of price gouging. It's a national concern. We recently found out recently, just the other day, from the Attorney General's office, there's a similar bill in Maryland passed, and the U.S. Court of Appeals on technicality based on, I'm sure you want to hear it, dormant commerce clause. Dormant commerce clause. Does anybody understand?
Right.
Yeah. It's one of those things you never hear about, except for lawyers in some obscure cases. They ruled 2-1 that it was unconstitutional based on that. What I'd like to do, Madam Chair, is send this to the Joint Commission on Health Care.
So moved. Second.
Okay. Well, thank you, Senator Edwards, for dispensing with that so quickly. That will go to the Joint Commission on Health Care.
I'll look that phrase up.
Dormant commerce clause. If you can figure it out, it's one of those things you in 5 minutes of law school, so I mentioned it, passed it, and you forgot about it.
I'll forget it and never use it again.
All right. Then it looks like Senator Chase is up next. And Senator Chase, you and Senator Wagner have similar bills. I saw him in here. Did he escape?
We told him he was fifth and he left.
Let me see if we can.
Let me take.
Grab him. Okay. So the Senate Bill 1004 is a similar bill that we saw last year. I've actually worked with the stakeholders, the hospital, to an agreement with Peace in the Valley. I actually have a substitute that I would like, it should be before you, that I would like to put up.
Second.
So, just to refresh your memory, the initial intent of this bill was to ensure that patients who are seeking elective procedures, that they would be able to secure some type of estimated cost of services prior to having that service provided. And we had a number of concerns on this committee, and I think the substitute is going to address that, as you'll hear from Scott Johnson and others. What the substitute does is it says that every hospital shall provide written information about the patient's ability to request an estimate of the payment amount pursuant to this section. Such written information shall be posted conspicuously in public areas of the hospital, including admissions or registration areas, and on any website maintained by the hospital. In section C, it simply adds that any physician, physician assistant, or nurse practitioner who practices in a off-base setting or his designee shall provide upon request of a patient a good faith estimate of the charges for such healthcare services for the patient. And I would like to bring forward, if I could, Scott Johnson and Brent Rawlings to talk about our substitute. So first, can we get a vote on the substitute? All in favor?
Aye.
All right.
Madam Chairman, members of the committee, Brent Rawlings, Virginia Hospital and Healthcare Association. We worked with Senator Chase on this legislation. As you recall, she had Senate Bill 721 last year. We had some concerns with that as presented. She agreed to forward that for a study to the Department of Health and Department of Health Professions. We were part of that process over the summer. One of the things that we identified was that while this is available to patients, some of them may not be aware of it, and that we can do more to promote this availability of this tool for patients to get more information about the cost of healthcare that they may be receiving. And so with that, we developed this substitute, which we think will help to further promote the availability of price estimates for patients receiving elective services, and think it represents certainly something that we can manage. The language in here reflects, is similar and consistent with and mirrors the language that already applies to hospitals with respect to their obligations to provide public information about their charity care policies, and would be complementary to that existing information.
Morning, Madam Chairman, members of the subcommittee, Scott Johnson. I worked on the back part of the bill, that's paragraph C on lines 36 through 38. And in follow-up to Senator Chase's bill last year, remember one of the things we did is Dr. David Brown at the Department of Health Professions included information in a newsletter to licensees, encouraging them, you know, when patients ask, we ought to be able to tell them what the charge is, so they can then call their insurance company and figure out their co-pays, deductibles, out of pocket, and the like. And so now we've come back with this, and appreciate Senator Chase working with us, and hope you'll support the bill.
Okay, thank you. Is there anybody else that wishes to speak in favor of the bill? Is there anybody that is opposed to the bill?
Second.
So, if I may, Scott and Brent, is there much difference between, what have you looked at Wagner's bill?
Yes.
Would you like to speak to
Madam
the
Chair,
similarities or
I've looked at
differences?
Senator Wagner's bill. Senator Wagner's bill is somewhat different. He leaves the existing language in 137.05 in place and adds an additional subsection on top of that, requiring hospitals to provide information about common procedures, certain inpatient and outpatient procedures, the price for them, and to post that on their website. We have expressed some concerns with Senator Wagner about that legislation, mostly because we're trying to better understand exactly what he's intending to accomplish with that. Clearly, we're supportive of greater transparency in healthcare, but we want to do it in a way that is user-friendly and accessible to the public. We're concerned that by having information on multiple websites and multiple hospitals, requiring multiple clicks for patients maybe isn't the best way to go about it. We think that there's existing authority for the Virginia Department of Health under their healthcare data reporting statutes to already do some of this. And so wanted to work with Senator Wagner, and actually spoke with him last night and provided him with some information. We're hopeful that we can find a pathway forward that will pull this information together in a more user-friendly manner through existing pathways through the Department of Health and potentially the ABCD. So that's but again, the language speaks to requiring hospitals to post on their websites the prices for certain procedures, and we just need a little more detail on what that is.
Yeah, so Frank, Senator Wagner?
Yes.
Would you maybe wanna come and speak to your, bill 1357, because I don't know if you've seen Senator Chase's bill, but it does pretty much a similar thing. It doesn't go.
I'll be delighted to roll it into Senator Chase's bill.
You would, do I have a motion
I'm
to
in a
that
very
effect?
quiet
Second.
All right, and so that's great. So now, Rolling, would you like to see what your new bill looks like?
Good, trust me.
Okay, so, we had a motion on Senator Chase's and now Senator Wagner's bill. We can chief co-patron them if that's okay with both of you. Say it again. A vote, right. All right, and we have a motion, correct? Do I have a second?
Second.
All right, all in favor?
Aye. Good job, Frank.
Okay,
Thank
so,
you.
thank you very much. Thank you. All right, Senator Chapin. Vote to report with the substitute. Thank you.
Second.
All in favor?
Aye.
Got it, thank you. Okay.
Thank you, Madam Mayor. I'm here to talk to you about Senate Bill 1221, which is telemedicine bill, and there is a substitute.
Move substitute.
All in favor of the substitute?
Aye.
So it is my hopes that the substitute resolves some of these significant problems that are there with this bill that revolve primarily around licensure, the licensure issue. And so, the driving force behind this bill is the existing, laws restrict, telemedicine to 50 miles from the borders of Virginia, and which significantly impacts
in rural Virginia, primarily in rural Virginia. So, we are hoping to improve the quality of care of all Virginians through this telemedicine. We think that this is a good tool to get started by enabling physicians to monitor and track patient information and unleashing telemedicine to allow remote care of Virginians who would otherwise not have the option of being treated by some of those highly skilled and proficient physicians. It also allows, it makes changes in the billing structure. Currently with regard to DMS, there's a difference in the way that in-person patient treatment is billed versus telemedicine. And this would put them on equal footing on those issues where it can be billed, where the services can be provided.
Very good. Are there questions from the committee?
So, this has been, utilized in Southwest Virginia by specialists for some time now, and, for remote areas in Southwest Virginia that, an individual may have to travel a long way or, may not even go to the doctor if they were, required to go somewhere like UVA or Charlottesville. They have some remote, telemedicine areas in parts of Southwest Virginia that offers this, and has been very successful. And I think what Senator Chafin's trying to do is to try to do some things remotely to prevent these health problems from occurring by having these monitored health telemedicine areas to monitor the health of the individual. And I think it's really needed in areas that we have, because there are long distances people have to drive, and their ability to get there is limited for the health care that they need.
Yes, Senator Floyd.
Thank you, Mayor. I have heard those relevant to
Certainly amenable to that.
So moved.
Second, good. All in favor of rolling? Second, say aye. Aye. Okay, that's wonderful. Thank you very much. Are there any other questions from the committee? Or any of those that wish to speak in favor of the bill?
Madam Chair, members of the committee, I'm Robert Dorado with the American Health Insurance Plans. I want to thank Senator Chafin for working with us on this. It's a good bill. It's reflective of what we do now. The important part of that was the insertion of medically necessary for the remote care that the insurance company would pay for. We want to encourage that they will continue to look for opportunities to utilize telemedicine to help bring quality care to folks that can't access it easily. Thank you.
Thank you.
Good morning, Madam Chair. Julie Dine with the Virginia Hospital Healthcare Association, and we support the bill. Want to certainly thank Senator Chafin and Senator Favola for bringing this to our attention. We very much support the bill.
Thank you.
Morning, Madam Chairman, Scott Johnson for the Medical Society. I want to also thank Senator Chafin and Senator Favola for working with us. We had concerns, and they've taken those out. That substitute removes the problems that we have about not having to have a Virginia license to provide the services, and so they've been great to work with. Thank you.
Americans for Prosperity, want to thank Senator Chafin and Senator Favola for bringing this important legislation to increase access and lower costs.
Thank you. Anybody else, anybody who wishes to speak against the bill? Wonderful. Do I have a motion?
So, move to report substitute.
All in favor?
Aye.
Very good, thank you so
Thank
much.
you so much.
And then Senator Wagner's on that quick line.
Yes.
Senator McClellan?
Morning. Senate Bill 1452, which you all saw last year, was a bill that passed the Senate 35 before. This allows for a pharmacy to issue a limited license at a reduced fee to a prescriber at a nonprofit facility to dispense birth control or
keeps them under the supervision of the Department of Pharmacy for all prescribing practices and parity with everybody else. It just affects the fees and actually, you know, how they are licensed. Are there any questions from the committee? Is there anybody who wishes to speak against this bill?
Madam Chair, members of the subcommittee, Jeff Caruso with the Virginia Catholic Conference. We opposed the bill last year and have similar concerns with this bill as well. Reduced fee, exemption from permitting fees, and it directs the adoption of emergency regulations. And we question whether this carve-out is necessary in this particular instance. Why would we be giving a carve-out in this one instance, whereas for other types of services, there's not a similar provision. Thank you.
Madam Chair, Josh Hetzer with the Family Foundation. We also opposed this last year. One of the things I would point out is, as we've looked at the inspection reports of the various abortion facilities, this bill appears to benefit particularly those facilities. Is that throughout, one of the main, I would say maybe the most common violation that we've seen is in the drug dispensing and storing category. A host of violations. It seems that these facilities have proven not to be able to handle this sort of issue. And so we think that this is not going in the right direction for that reason. So we oppose the bill. Thanks.
Is there anybody who wishes to speak in favor of the bill?
There was, last year, Wendy Klein, who is a doctor at a clinic, testified she was unable to be here today. She's seeing patients. She did submit a letter, in the interest of time, I'll just share.
Thank you. Okay, do I have a motion?
Move to report. Second.
All in favor?
Aye.
All opposed?
No.
I will, say aye, but it fails in committee. It doesn't get a recommendation. I guess it will go to full committee. We'll go through three and take a look at it.
Thank you, Madam Chair.
Okay. Let's see what we have next.
3-3 no recommendation.
Senator Marsden. Okay, very good. I guess I can do my bill that I have here. Field chair.
Yes, happy to do it. The subcommittee will direct its attention to Senator Donovan's Senate Bill 1557. Senator Donovan.
Thank you. 1557 is an attempt to make some changes in the plans for our pharmacies that have just been licensed this year to provide CBD and THCA in Virginia, starting this year. And there are a few things about this bill that it seeks to accomplish, and there are a few things that are not settled out yet. So I'm hoping that we're going to be able to move this on to the full committee without having resolved some of those problems, if it is the pleasure of this committee, just to give us a little bit more time. We're still including stakeholders and ironing out some issues. What this basically does is it includes nurse practitioners and PAs in being able to recommend the treatment, and that doesn't seem to have any contentious concerns. It is seeking to define that we maintain the Virginia standard of pharmacy to pharmacy technician ratio of 1:4, but that we clarify that cultivators and probably extractors do not apply to that ratio. And then the last element in here is to talk a little bit about the formulations and how we would dose those. So two of the issues are the percent of THCA that is in any preparation, and the other is is there a value in having a dose limit? And while you cannot have an overdose, and none has ever been described of THC or CBD, there can be some unpleasant and negative effects, and we also want to make sure that that's controlled. You know, if somebody other in the family gets a hold of that is naive to the medication. So pretty much standardly across the country, a 10 milligram dose unit is limited. So one dose, you might take several doses, but one unit is no more than 10 milligrams. We're still discussing what percent would be allowable and if we're gonna make a change this year, but that is the part that we have to decide as we go forward. And the idea about actually the pharmacy ratio and the PA and nurse practitioners, I think, is in consensus.
All right. Any questions from the committee? Senator Carrico.
Just a simple question. I think you were talking about the percentage. So in the 10 milligram, what is the expected percentage of THC that would be in 10 milligrams?
So as I understand it, and I might have the Board of Pharmacy speak to this because it's hard for me to really equivalate and translate between the percent, but a 5% could lead up to 50 milligrams per dose. Is that correct, Caroline? And so we thought that was excessive for a single unit of dosing. Now you could maybe, if your prescription was for 20 milligrams, you might take 2 pills at a dose. But the idea is that we not have a single pill that has more than 10 milligrams in it, just as some, guardrails per se.
But that's not determined yet, right?
I think the 10 milligram dosing is consensus, yes, for a unit dose.
Are there other questions from the subcommittee? All right, we've got another bill that has a piece of this. It's Senator Marsden's Senate Bill 1719. What I think is going to end up happening is if we have a favorable report on Senator Donovan's bill, which has the lower number, we will likely roll that in, but we will wait till he gets here until we do that in case he's got a reason he'd like to provide why that's not the best course. So now what I'd first like to do is hear from anyone that has any concerns about Senator Donovan's bill, or also Senator Marsden's bill, with the understanding that he'll be here soon, we hope. So is there anyone that has any concerns with the bill as it's currently before us? All right, come up, state your name, and briefly and concisely make your case on what your concern is.
Thank you. My name is Dr. Mary Crozier. I'm from Virginia Beach. I am the chair of the Community Coalitions of Virginia. We represent 38 different community coalitions around Virginia, as well as organizations, departments, individuals in recovery, etc. So we reflect a real pulse of the community, real boots on the ground. So we'd be the first to kind of feel any kind of unintended consequences from some of these bills. So we encourage you to take a comprehensive, long-range, and research-based approach. Look at what FDA, AMA, look at what research would say, and all the longitudinal data coming out of other states. So there's a lot the medical community has to inform us about, and that is that we don't have an official algorithm as to the question that was posed earlier, how much THC equals what kind of exact reactions. We know that from alcohol. We have a blood alcohol level and measuring devices. We don't have such tools yet. So that's why we're encouraging you to exercise some prudence in opposing this, in opposing a rush to expand or change. This being our first year of just getting the processors up and going. We need time for the Board of Pharmacy to implement and enact all their policies. I think we need to maintain them in the driver's seat, let them use the limited research that is available on all this, and look at a reduced level of THC, because we know with decarbonization, The changes in temperature, there can be changes in the THC. The higher the THC, the higher the number of consequences. So I appreciate your prudence in looking at this question.
Thank you. And Senator Marsden, if you'd like to come have a seat, what we're hearing right now is folks that have concerns with Senator Donovan's Senate Bill 1557, which is similar to your Senate Bill 1719. So we're gonna hear all the different folks' thoughts, and then we're gonna
Mr.
go
Chairman,
from there.
then I have a question for Senator Marsden if we're gonna talk about his bill.
Sure.
Senator Marsden, what is the deal with the agents picking up the drug? Is there any other prescription medicine that we let agents pick up the drugs?
You know,
Senator Donovan's nodding her head, so you.
It is, you know, I pick up my wife's prescriptions, you know, that type of thing, so.
Do you get it from?
But in this, because it is so heavily regulated here, and we, you know, we're very cautious, we had to put in the affirmative defense aspect to the bill, because, you know, we wanted to make sure that people who possess these oils couldn't be prosecuted. So it's a kind of a different level of issue there. And a lot of these are disabled adults who can't go pick them up, or who may not be able to come downstairs to meet the delivery man. And they may not have a legal guardian there present, but a home health care worker. And so it's very important to be able to have others able to receive these very important medicines.
I understand the parent or
One
someone.
second.
Chairman.
On that question, Senator Donovan, do you want to respond to that question as well?
I would appreciate it, yes. So as it currently exists, you can pick up your prescriptions for your family members, often with just an ID if it's a instance. This is a higher level of accountability, because in order to receive this prescription or this compound, you would actually have to be a registered agent. So it goes beyond what the expectations are for all of our regular prescriptions, including controlled substances, and that you would have to be on the registry and be identified in order to be the recipient of that. But say a disabled individual could have a couple of different registered agents that are carried, that have been processed and reviewed, and they would be able to receive the medication on behalf of the patient.
Do you have a follow-up question, Senator Peake?
And I'll just state to the patron, yeah, I understand parents, guardians, things like that. And maybe just the way I read it, I don't want the situation where somebody is registering as the agent for 8, 9, 20 of these people. Hey, let me go pick up your THC, and I don't want to become a commercial agent, I guess, for picking up marijuana.
Senator Peake, if I might, I think you're going to find here that there may be a possibility that somebody could be for 1 or 2 individuals, but the geography is such that that's probably going to be unlikely, and that would occur.
And that was my concern, so thank you.
All right, are there any other questions from the subcommittee right now, or should we move back to folks that have concerns? So, if you have concerns with it, please say who you are, but also start off saying if you have concerns with how it's written, or if you think the policy is just not where we ought to go.
My name is Regina Whitsett, and I'm the Executive Director of SAFE, or Substance Abuse Prevention Coalition in Chesterfield. And we've been speaking in opposition to these bills for years now. I would be remiss if I didn't mention that marijuana and its extracts are addictive, illegal Schedule I drugs according to federal law and the DEA. Also, Epidiolex is now an FDA-approved medicine for patients with intractable epilepsy, and there are FDA-approved medicines for other illnesses. One of our concerns is the bill removes the 5% cap on the THC, which has already been addressed. This bill no longer is talking about CBD-only oils for intractable epilepsy patients and other medical conditions. Now we are talking about THC concentrates with no limit. This is about full-blown medical marijuana and the marijuana industry moving into Virginia. Also, another concern we have is passage of this bill will allow licensed physician assistants and licensed nurse practitioners to issue the written certifications for the THCA oils. I was on the Virginia Board of Pharmacy Regulatory Advisory Panel, which consisted of physicians and pharmacists that met for several days over several months to establish the regulations that haven't yet even been fully implemented and tested. The panel determined that it was best for a physician with a bona fide doctor-patient relationship to be the one to provide the written certifications. Also, this bill removes the requirement that a licensed pharmacist provide on-premise supervision of pharmaceutical processors. Again, this was a regulation that the Virginia Board of Pharmacy created to provide adequate oversight to this pharmaceutical experiment. And I'm speaking to Senator Dunavant's bill at this point. I also believe it removes that pharmacists needs to be the ones to dispense, that it actually sets it up for pharmacy technicians, and we don't agree with that. Speaking about Senator Marsden's bill, we do have grave concerns about designating a registered agent for the purpose of receiving the oils. This will actually, we believe, set up the caregiver model, which I had talked to you all about years before, where Virginia will have several people that can be caregivers for a person and go get their THC oils and deliver to them. And I actually thought there was a delivery service involved in one of Senator Marsden's previous bills. The bill authorizes the board to set up a limit for the number of patients for whom the individual is the authorized agent. In Colorado, a caregiver model actually allows up to 9 patients. So I could technically not just pick up for my family, but I could pick up for my neighbor, for someone else in my neighborhood. And of course, there are exceptions where they can add more people to that. So those are some of our concerns. And what we believe this caregiver model will do here in Virginia is actually set up the gray and black market, where there's gonna be THC oils out there that aren't gonna be getting delivered to the patients who actually need them. Additionally, I just have a few more comments. The bill allows employees access to the cultivation and extraction areas without a pharmacist on site. And so this is basically turning over the pharmaceutical processing to horticulturists, to chemistry graduates, and to the marijuana industry that has now come into our state.
All right, well, I think the subcommittee understands that you strongly your organization strongly oppose anything in this direction.
Well, actually,
and there's several folks lined up behind you, so I'd like to hear from them too.
Okay.
There's no amendment that can make the bill acceptable to you, correct?
That's not true. We do want to help with the language. We started helping with the language very early on. We want to make sure that why don't we wait until the Board of Pharmacy regulatory system is up and running.
So then there wouldn't be any bill at this time then that would be worked? Okay.
That's correct.
Thank you.
Thank you.
Other folks that have concerns with the bill as it's written or opposed to policy outright? Yes, ma'am.
Good morning, Christina Borelli with the Virginia Pharmacists Association. Our only concern is with Section D.
Section D of
Senator Dunavant's bill.
Yeah.
We've been working with her, and I believe we're going to do an amendment to kind of address our issue. We understand that the processors want to put a little bit more leeway around pharmacist oversight over the cultivation area. And we understand that growing is a 24-hour operation, and so we're willing to work with that, but obviously this would be setting a precedent. No other pharmacy in the state of Virginia is allowed to operate without a pharmacist oversight. We also have concerns about removing the on-premise language. We don't want it to be that we have a telepharmacist doing any sort of consultation, and so if we could just kind of work that out a little bit logistically, I think it'd be good to go.
Thank you for that. Is there anyone else that has any concerns with this? All right, folks that are in favor of it, we've got the patrons who, are making the case for the general policy, so please very concisely state why we should go this way and possibly any of the concerns that have been raised, why perhaps we shouldn't give as much credence to those. What's your response to those? So please come up, identify yourself, and go very concisely.
Thank you for letting me speak today. My name is Tamara Netzel, and I have secondary progressive multiple sclerosis with glossopharyngeal neuralgia, vocal cord paresis, muscle spasm, intermittent neurogenic bladder. And in other words, my cranial nerves are deteriorating. I need flexibility for my doctor to have the tools that other patients have in other states and in other countries. The National MS Society supports patients' medical freedom to work with their doctors to treat with medical cannabis, and the society actually advocates for regulating medical cannabis at the state level, while they look, and I will quote, for ways we can remove the barriers to allowing research on medical cannabis at the federal level. So, around the world, MS patients like me have access to a safe, effective medical-grade cannabis preparation named Sativex, proven by research to be effective for MS. These patients are thriving with their MS, not just surviving. I want that potential to thrive with my illness, and I want my doctors to have all the tools available to doctors in other states and countries to treat my illness. So Senator Dunavant's bill, by supporting it, you're allowing all Virginians that medical freedom and the potential to thrive.
Thank you. Anyone else that would like to speak?
Thank you, Mr. Chair. Members of the committee, Jen Michelle Bedini on behalf of Virginia Normal and Virginia Cannabis Industry Association. We support the bills. We thank Senator Marsden and Senator Dunavant for continuing the work on this issue. Our primary goal, number one, is to streamline the process for patients and ensure that their physicians are able to recommend therapeutic dosages and the formulations that are standards of care around the country for their disease processes, and of course to have flexibility within the pharmaceutical processors to create a viable industry. Thank you.
Mr. Chairman, Andrew Lamar on behalf of the Virginia Nurses Association, which strongly supports the bill, and appreciate the Senator including nurse practitioners. Also representing PharmaCann, is one of the pharmaceutical processors in Stanton. Working with the Senator to come to consensus around some of these details that she described, but strongly support the bill, and thanks for bringing it.
Thank you.
Good morning, Ashley Allen on behalf of Dharma Pharmaceuticals, which is serving Region 3 in Virginia. We support both pieces of legislation and thank the patrons for your work on this. In particular, please address some of the issues that we've seen as we're starting to try and get up and running in Virginia, and appreciate the work being done.
Madam Chair,
yes,
members of the committee, James Pickrell representing Greenleaf Medical of Virginia. We are the pharmaceutical process for HSA4. We'd like to offer our strong support for both Senator Dunn and Senator Marsden's bills, and thank them for working so hard on this issue. Thank you.
Madam Chair, David Halleck on behalf of Columbia Care, which is the processor licensee in Hampton Roads region. We've worked very closely with Senator Lucas to be in the great city of Portsmouth for our processor. That front, and we also strongly support both bills. Thank you.
Thank you. All right, so we've got the two bills before us.
Has that bill been presented? Explain.
Well, you can explain your bill right now, sir.
Okay. That's
because we've heard the folks that have the concerns with it.
Yeah.
So basically, what we'd like to hear is the biggest differences between yours and Senator Dunavant's approaches.
Well, I think Senator Dunavant's approach is more on the medical end of things with the oils. Mine, what I did here is I brought together the 5 processors who received the licenses here in Virginia, and my charge to them was, I want you to suggest, because of your experience and what you see here in Virginia under our current regulations, what we can do to streamline your business, to make it more efficient, to allow it to operate in ways where you can make money and reduce the cost to consumers. It's important to reduce the cost because this is not covered by insurance. This is a cash purchase that people are making, and it's going to be burdensome. And so the goal was to bring these professionals together, these 5 groups who have experience in other states, who have experience with medical marijuana, who are experienced business people, and to bring them together to make sure that what we've got here is a business model that works. And so I avoided a lot of the medical issues because I knew Senator Dunavant was going to be dealing with that, and focused on how best to staff and supervise people in the facilities, and how best to get products to people because most of these registered agents are not going to be driving someplace to pick medicine up. They're going to be in the home receiving that medicine when it arrives with a patient who may be incapacitated and not able to get to the front door. Remember, we don't have dispensaries here in Virginia. This is a vertically integrated model. You will grow, process, and distribute from the same location. Other states have different models. This one is the vertically integrated one. That's why we need the registered agents. And we needed to tweak some of the time frames on how long it takes to put the product in the ground to be able to harvest it. So these are small changes to the current law that allows these facilities to get up and running and start providing relief to people. And that's really the difference between our two bills. I've focused on the business operations, and Senator Donovan, because of her vast knowledge in the medical area, has focused on the more medicinal aspects. And so we have sort of the yin and yang here, the more medically focused bill and the more business focused bill.
All right, thank you, Senator Marston. Does anyone on the subcommittee have any questions now for either patrons, now that you've heard both presentations and you've heard folks that have concerns and also folks that support the proposals? Would someone like to make a motion?
I would move Senator Donovan's bill. We're gonna do them separately. They've not been rolled into each other.
No, so the preference, or the opportunities for the committee as I see them right now are to recommend report of one bill or both.
I would say both. I think they ought to be separate because they're two separate issues as I see it.
Yep, I agree. So I move to report Senator Donovan's bill.
Second.
All right, Senator Donovan, you want to speak to that motion? Because I think you might have some amendments before full committee, is that correct?
That's correct. And, it is my goal to reach consensus that is very much consistent with safe oversight by the Board of Pharmacy to ensure that we have, the ability. What happened is last year when we opened this up to a lot of additional conditions, it really changed the way we need to look at what is dispensed. And so we're trying to find a way to navigate that so that we can accommodate appropriate therapeutic dosing for all of those different medical conditions, but also make sure that we have the checks and balances in place for something that's new. So I would like to have a little bit more time to accomplish that goal, because that's what's in here, and we're gonna address all of those issues before it goes to committee.
Okay, so we've got the motion before us. Just what I want everyone that's interested in this to know is what I expect will happen is there will be a recommendation or not a recommendation from this subcommittee on the legislation, but today's been the public hearing. So we've heard, from folks that what their particular concerns are, and we've heard from folks that don't think it's a good idea at all at this time, and we've heard from folks that are very enthusiastic about it at this time and the approaches that are taken in this bill. So today's the public hearing. I think that we're probably going to have amendments offered at full committee that will either address the concerns that folks had or they'll at least seek to. But so we've heard the folks that had the opportunity to talk today. So I don't anticipate there's gonna be a public hearing on Thursday as well. So the motion before us right now is to recommend Senate Bill 1557 with the understanding that there will likely be amendments that will not expand the scope of the bill, but would narrow the scope of the bill. So is everyone comfortable with that and understanding where we are? All right, is there any discussion on that motion? All right, as many as favor the motion to recommend report by the full committee of Senate Bill 1557 will say aye.
Aye.
And folks that have a concern with, or folks that would oppose that motion will vote no. All right, and
now, Mr.
Erickson's
Chairman,
proxy was recommended.
To vote in favor.
So that's a 6-0 recommendation. for a report. And I think Senator Lucas.
Yes, now, Mr. Chairman, I'd like to move, to report Senate Bill 1719.
Mr. Chairman?
All right, so we've got a motion to recommend report for Senate Bill 1719. That was Senator Marsden's bill that we just had conversation about. Any discussion, Senator Donovan?
I do think that we need to have Senator Marsden describe what those changes are. I think there's a lot of consensus around registered agents, but I think there's some other issues that we haven't actually discussed, like wholesale of product between different pharmacies, and I'm a little concerned that that may be a little bit more controversial, and we actually need to have a conversation about it. And there's several other things, there's several other changes to how the business would work that are in here that I think we should hear you tell us what they are.
Certainly, startup processors like those here in Virginia may not have the ability to manufacture a sufficient range of products in terms of dosages and types. This would allow finished product to be shipped between the 5 processors while maintaining the manufacturing and security standards. In other words, making sure that product is available to people, especially in these startup phases. We want these businesses, and I think it's admirable that they're willing to sort of cooperate with each other to make sure that product is available to people. I doubt, and someone could correct me from the industry, I would doubt seriously that whether this would be a long-term practice, but certainly in the startup phases, it would be something that they have found to be important in other states. The last thing in the world we want is somebody who has a relationship with a particular processor who can't provide that product at that particular point in time. They're not registered with another processor and just can't up and go and drive 200 miles to sign up with them to get their product. And I hope I'm not misstating the issue. I'm getting an affirmative there that that's sort of the problem, and this is especially evident in the beginning stages of this. We've brought these 5 folks together with a team spirit of they're going to be competitors, but at the same time, I think it's admirable that they're willing to cooperate, put together this bill at my request, and put ways for them to cooperate, because the important thing here is getting these important services and products to patients.
And then you have, if I may, Mr. Chairman.
Yes, Senator Donovan.
You have some language about cultivation, extraction, and dispensing that changes around under F on line 144.
Is that allowing the cultivation to begin on an issued permit with production no sooner than 60 days prior to opening?
No, I think this is changing around pharmaceutical processors and cultivation-related duties, and I think that's something we've been talking with the Board of Pharmacy about, and I think that we should probably align our language on a lot of that so that it's similar between the 2 bills. But I wonder if the Board of Pharmacy has comment on, and wonder if Caroline could tell us if there's any concerns about some of these business changes, and if we have if it's okay with you guys, then I'm speaking out of turn.
Is there anyone from the Board of Pharmacy that would like to speak?
Good morning, Caroline Turin, Executive Director with the Virginia Board of Pharmacy. We have some internal concerns with respect to the pharmacist supervision piece, but we do not have an official position in the administration.
So
but we
have,
would be very happy to engage in further discussion on this topic.
all right, so you've got concerns about a piece of it, but you don't have an official position. That's the short version.
Yes.
All right, thank you. So we've got this motion right now before us. It's to recommend a report on this bill that we just heard from folks with the Board of Pharmacy don't have a position on, but they at least have a piece of it that they'd like to look at a little more intensely. The current anticipation is that this will be likely heard on Thursday. It being a short session, we have been encouraged to move things quickly. So folks that have that really want to see this bill advance this year, if we get a recommendation to report, we'll need to work with Senator Morrison very intensely over the next 48 hours so that it's in a position for the full committee. Because again, today was the public hearing on both bills. And you will need to talk with members of Senate Education and Health between now and then as well to share your views. Everyone understand where we are on that? All right, any discussion from the subcommittee on this motion to recommend report? Senator Peak.
Yes, Mr. Chairman, and Senator Morrison, I think I will be fine. And I know my position is somewhat irrational. It's like a guy who likes to eat steak but doesn't like to hear about the cow being slaughtered. And so I'm okay with cannabis oil, but it disturbs me to hear about growing and producing and product, and it's marijuana in Virginia. And so I need a little bit of time to comprehend all these things. So I'm going to abstain.
Yeah. Okay. And Mr. Chairman, Senator Duncan and I will work together to make our language work and relieve any concerns that people have. We have a lot of experts in the industry, and we're both very familiar with having sponsored these bills now for several years. And I think we can get this right for the full committee if we report this bill.
All right, any more discussion? As many as favor the recommendation to report will vote aye.
Aye.
As many as oppose it will vote no. And those that would like to abstain to keep it that way. So, where does Senator Kerr go?
He didn't leave me direction.
All right, so what we're gonna have is there's 3 votes in the affirmative to recommend. Those are Donovan, Lucas, and Barker. And then you're gonna have 2 votes in abstention. That is Suderline and Peak. And I think you understand we're both, I'm not quite as creative with my language as Senator Peak, but I also have some questions before I want to endorse the bill. And then Senator Carrico, it was going to be, we'll abstain him as well. That Senator Donovan has his proxy. All right, so that completes these bills for today. Folks that have an intense interest in seeing this pass this year need to talk with the patrons and other members of education and health. We've got one more bill for folks that are interested. And I think it's going to be an interesting lineup for the committee that's left. Senate Bill 1694.
Yes, Senate Bill 1694. As the subcommittee is aware, over the last few years, we've been dealing with issues related to mental health professionals and trying to make sure we have the right enough people providing mental health services, the right training for them, and help individuals move from lower and mid-level positions toward licensure and those types of things. Among the things that we've done over the last couple of years has been to establish an indication in the code for categorization in the code for qualified mental health professionals. We've also done it for peer recovery specialists and others. What this would do is over the last year or so, there's been a stakeholders group that has worked on with sort of where we go with the qualified mental health professional categorization, which has been in place for a couple of years now. And what they propose is incorporated in this bill, which is going to, from the current categorization of just qualified mental health professional, to having separate categorizations of qualified mental health professional involved with the tier 2 adults, separate categorization of qualified mental health professional who's dealing with children and adolescents, and the third categorization of a qualified mental health professional trainee. These people in this category are providing valuable service both in the public sector and the private sector right now. They're helping us provide services. They're working with licensed professionals to be able to provide those services, and I think this is the next step forward. And I do have a number of people here who can help address the issues and sort of how they came to consensus on this proposal.
All right. This is similar to a bill that we heard last year from Senator Barker that the Senate reported 40-0. the House had difference of opinion. Is there any substantive difference between this year and last year's approach?
There are some differences, and certainly the people who work on things can explain some of that, but also, we built a broader consensus and broader involvement of everybody in this effort, so.
Is there anyone in the audience that has any concern about Senator Barker's approach this year? This subcommittee endorsed his approach last year, and I think this year, I was probably the person on the subcommittee, I think, that asked the most questions last year, and I voted for it. So I'm not sure there's anyone more skeptical. Is there anyone that has any more concerns about this bill? Otherwise, there's about to be a motion.
Move the report.
Second.
All right, we've got a motion to recommend report. Is there any discussion? Hearing none, as many as favor recommending report will vote aye.
Aye.
Opposed will vote no, and it recommends on a 5-0 vote. And that completes our business for today.
Yeah.